Welcome everybody to the Master of Nursing Science Information Evening. Sorry that we can't be doing this in person as anticipated, but great to have the opportunity to do it virtually. I'm just going to give you a wee bit of a, excuse me while I get my technology under control, a wee bit of an outline of how tonight's going to go. So we're going to talk, myself, Virginia Jones, and Chris Moyer will outline and discuss the academic and clinical aspects of the program. And then we're very lucky to have Lana and Laura Barnett, who are both in their final year of the Master of Nursing Science program, who are going to come and talk about their student experience. And then I'm going to show a short video on the simulation suite to give you an idea of what the campus looks like in the simulation suite. And then at the end, there'll be an opportunity for questions to be answered. So the Master of Nursing Science program was the first pre-registration master's program of its kind in New Zealand, and it's been going since 2016. And to date, we've had 100% success rate for graduates registering as an RN, and about a 97% have secured jobs as RNs post the course. So the program is actually taught here in Christchurch at the Centre for Postgraduate Nursing, and that's at 72 Oxford Terrace, which is just in town, basically a block over from Ballantynes, if you know Christchurch. It's also just down the road from Christchurch Hospital. And Christchurch Hospital is the largest tertiary hospital in the South Island and is the major trauma centre for the northern and central Canterbury. So a lot of our students undertake clinical placements in the Canterbury DHB. So Otago University, and you guys will know this because most of you are from actually in Otago University at the moment, but I'll just give you a wee bit of outline. Otago University has around 21,000 students, and they're across 5 main campuses in New Zealand. And you guys will know because you've come from the Dunedin campus, of course, but there's also a campus in Auckland, Christchurch, which is the campus that we're on, Invercargill and Wellington. And as you'll know, it is one of the only 2 medical schools in New Zealand, and our medical school sits within a large health science division, which is also where the Centre for Postgraduate Nursing sits within. And this health science division has a strong reputation for teaching and research excellence. The Centre for Postgraduate Nursing is ranked in the top 100 nursing schools in the world as per QSR rating. And has highly qualified academics who are research active and maintain strong links with the clinical sector, with a number of our academics having joint positions with the Canterbury District Health Board. The university provides technology-enhanced learning and teaching, including a high-quality simulation centre that is on the Christchurch campus and in the same building as the Centre for Postgraduate Nursing. Due to the ageing workforce, which is 91% are aged over 50 years or over, almost 20% of them are over 60 years or older, and an ageing population, there is a national nursing shortage. The picture is similar internationally. According to the International Council of Nurses, it is predicted that 13 million nurses will be needed to fill the global nursing shortage in the future. So if you guys decide to undertake the Master of Nursing Science program and become a registered nurse, you'll be joining a profession that is in high demand with many, many opportunities. So the Master of Nursing Science program, as I said, it's the first program of its kind in New Zealand, and it's a pre-registration master's program. So the notion is that you're coming in to do this 2-year full-time program and at a master's level, and then you're eligible to become a registered nurse to sit the state final. As you'll know on the website, it's open to graduates from any discipline. So it doesn't matter if you come from a science background, if you come from an arts background, a commerce background, any background, as long as you've got a B average in the last 2 years of your undergraduate degree, you're eligible to apply. It's a reasonably flexible program in that we have class teaching on campus, and then the rest of the time is self-directed learning. And Lana will tell you a wee bit about her experience with that. The clinical placements are available throughout the South Island, and Chris will talk to those a wee bit later, but the notion is that if we do offer clinical placements throughout the South Island, so if you happen to be in Dunedin, we can offer clinical placements down there. You have access to the state-of-the-art simulation centre. Simulation happens every Tuesday afternoon in the first year while you're in class, and that's an opportunity for you to learn clinical skills before you go out into the clinical environment. The next page. So Steps to become a registered nurse. So you need to complete this program within 4 years. Then on successful completion, you're eligible to sit the National Nursing Licensure exam. And this is set by the New Zealand Nursing Council, which is the nursing regulatory body. So once you've passed the exam, you are then able to work as a registered nurse within the New Zealand health system. And this can be in the tertiary sector, the primary sector, private clinics, private hospitals, and that's just to name a few. You can also work within Australia. We have a Trans-Tasman agreement, so you're eligible to work within Australia as well. So we don't have the most up-to-date tuition fees for next year, but what I can give you is the tuition fees for this year. So for 2021, for domestic students, so those students that are New Zealand residents or New Zealand citizens, the fees were $11,112 a year, and for international students, it's $42,281 a year. There are also some other course-related costs, such as uniform. You have to be fully immunised before you come in, so there might be costs with immunisations. There are textbooks. We also have a $280 student services levy, which I think you guys will probably all used to paying in your undergraduate student fees. And there also might be some costs associated with clinical placements. So I'm going to talk to the Inclass side of the program. So as I said before, it's a 2-year intensive full-time course in which you complete 13 compulsory papers over the 2 years. Now, this program only has one intake a year in February, and students sit the state exam in November the following year. So even though we say it's 2 years, it's a very intensive program, and actually you only get about 5 weeks over the December break. So it's a very shortened, it's a 2-year, but sort of an 18-month program over sort of these 2 years. Because it's a master's level, the face-to-face teaching is only across 2 days, and that's usually Monday and Tuesday in year 1 and Tuesday and Wednesday in year 2. And it is expected that for the rest of the week, you'll be undertaking self-directed learning. There are a number of clinically focused papers, such as altered healthcare states, which teaches students about looking after people with surgical or medical issues. Mental health paper, which focuses on mental health conditions and management. There's also a complex care paper, which teaches students about caring for individuals who might have a number of health conditions or are undergoing rehabilitation. There are also a number of papers that focus on health policy and in the New Zealand context. There are also 3 science papers, and as I said before, because we take students from any undergraduate degree, we teach all the aspects of the nursing that you need to know to become a registered nurse. So it doesn't matter that you don't come from a science background. As long as students pass the papers, they can progress through the course. And there are part-time options available. And if this is something you wish to consider, it's best to organise an appointment with me, and we will work through an individual program study that best suits your circumstances. I'm going to now turn it over to Chris. Thanks, Chris.
Kia ora, I'm Chris Moore. I'm the Clinical Coordinator for the Masters of Nursing Science. I'm based here in Christchurch. So Ginny's told you about some of the placements that we offer: acute care, mental health, complex care. We usually start the first placement though in the first year pretty quickly. We have students out already by April, having commenced in February, and that's for a 2-week aged residential care placement. So, and that's fully supported with an academic staff member with the students, with a group of about 6 students in a facility. So then they move on quite quickly then in June, July into a primary health placement. So in the community somewhere, in either a GP practice or an NGO, a non-governmental organisation such as a Can Breathe, or which focuses on respiratory care, or something out in the community with people, which I think is a really good time to have that placement. Then as well as those other placements, so in all these 6 placements, the others, the primary health, acute care, mental health and complex care are all 5-week placements across the first and second year, and then the last placement is a 9-week, what we call capstone placement. So that's your transition or consolidation placement in a longer placement that Nursing Council wants to see students do before they qualify, so before they sit their state final exam and go on to register. So all of the placements are supported with both clinical. We have a good relationship with the clinical areas, so there'll be clinical preceptors or clinical liaison nurses assigned to support you in the clinical practice. And then we also, we also support you with academic staff members in each placement who work with you and see you every week and are there to really make that link between what you're learning in class and what you're learning in the clinical environment. So information across the papers is scaffolded, so you're building on your skills and knowledge across the placements. We do place students across the South Island. For the most part, we place students in the Canterbury DHB and in Dunedin in the Southern DHB. I have placed students in Cromwell, Dunedin, Nelson, West Coast. So, you know, I'm really open to placing students wherever they want to be. And in order to do that, though, there's often some costs, as Ginny was saying, associated with that. That might be travel, it might be accommodation. So that's why I encourage students, if they have family somewhere or know people somewhere that they would like to go, that they ask, you know, about perhaps if they can stay for a period of a placement, just to give them some experience in other areas. So I think that's about all I've got to say at this point, Ginny.
Thanks, Chris. I'm just going to, this technology, here we go, and I'm just going to pass you over to Lana and Laura. So as I said before, Lana's going to talk to you about her experience of the Master's Students Program from an academic perspective. So she'll start, and then Laura will talk about her clinical experience. Thanks, Alana.
Hey, so I'm Alana, one of the second final year nursing students. I guess, yeah, from my perspective, I would just reiterate what Jenny said about this being an intensive course. You learn a lot in the 2 years, and while you only have 2 days in class and with face-to-face, there's a lot of work that needs to go in outside of class, but I mean, it is what I make of it. So it is very self-directed. It's not like an undergraduate where you are spoon-fed. You're definitely taught things, but time management and self-motivation and being studious is definitely important if you don't want to suddenly find things piling up. And that's something that our class has had to learn, which, you know, it's part of the journey, and it's been fun, but it's definitely important to try and chip away at it. I think I come from a science background, so my undergraduate degree was in neuroscience, and I had a minor in linguistics and did some other arts papers as well, which I think it's been really beneficial because the style of writing, I think that my arts papers have helped with the style of writing within assignments of the Master of Nursing Science, but then my major has definitely helped learn the science side of nursing. So fellow classmates who have come from non-science backgrounds have struggled a little bit with just relearning, I suppose, the science language. But that's not to say that it's not possible at all. Laura can attest that it's possible. But yeah, so I think it is a big step if you are coming from a non-science background, but it's definitely possible, and the value of coming from arts or commerce is huge because you bring your personality and your experience to being a nurse. I definitely would say that there's help available if you need it, and not to hesitate to ask. I think it is important to ask because you do need to advocate for yourself, and if you're struggling, there is no point just wallowing, because then you really get into a sticky situation. And yeah, lecturers are really supportive if you need help. Also, I think yeah, it's important to draw from your other classmates as well, in terms of academic support, and just band together in that. But I think overall it's been quite positive. I've personally really enjoyed the research side of it, which is part of our second, it's a full year paper in your second year. It does start at the end of your first year, and I've looked at how nurses in acute stroke unit have found using guidelines for providing care. So it is a small scope, but it's definitely been an enjoyable process for myself. And there's lots of opportunities to sort of like there's heaps of options for the research project as well. Often you'll find that supervisors will suggest projects that they think would be good, but if none of them sort of take your fancy, you can come up with your own one as well, which is what I did, and they are open to that as well. So yeah, I think if you guys have questions at the end, then I'm happy to also answer those. I think that's my experience from the academic side.
Thanks, Alana. Laura.
Hiya, my name's Laura, and I'm also in the same class as Alana in the second year. So thanks Alana for talking about the academic side of things, and I'm here to talk about the clinical side of things. Just on the academic side as well, I come from a Bachelor of Arts background. So yeah, I can definitely agree with Alana that it doesn't matter which background you come from. This is a master's degree for everyone who's interested in entering into nursing and interested at doing things at a master's level at the same time. So yeah, definitely it made the science a bit more challenging, but I'm really glad that I've got the writing experience from my Bachelor of Arts. So yeah, more about the clinical experience. I loved the 6 clinical experiences. So we started off with aged residential care just for a couple of weeks. So everyone in the class was in an aged residential facility, and that was starting off, all in similar kind of areas. So the following clinical experiences after that, we all started branching off into different areas. And we got to sort of pick our interests a little bit more if there were spaces available. But with aged residential care, it was a really great place to start because we all had slightly more similar experiences, and an aging population is really important in New Zealand. It's something that's current and happening. So it was a really great place to start. And I personally love working with older people. I found it really humbling and really interesting. There's also a lot of where we were mostly working in the hospital level care of aged residential facilities. So we were working, directly with the nurse, and we had a lot more support. So we were doing things more in a group and learning that way. Whereas in the following placements, we were separated out and doing things more, individually with one-on-one with nurses. So yeah, in that one, I learned a lot about dementia, different comorbidities and aging, polypharmacy when aged people are taking multiple drugs at the same time, multiple medications. Also common things like diabetes or, heart disease, lung diseases, things like that. And then the second placement was primary health or community health. I was really lucky. I got to try a few different things. So I spent a few weeks with Waitaha Primary Health Organisation. And so from there, I got to see the overview of how health works in a CDHB or within a primary health organisation. So how it's actually the Ministry of Health funding channels down and how it's allocated out to GPs based on the needs in different areas. I got to do sort of one-off interesting things like before school checks and work with lactation consultants. I got to work with special services for Māori health or for Pacifica health, and go and visit people and families in their houses, and work with like specific individual needs across different socioeconomic areas of Christchurch. So that was really, really interesting, and like working with different cultural groups. And then I had a couple of weeks in some GP clinics after that. And that was really great as well for getting really hands-on and getting to do some vaccinations and a lot more hands-on work and patient education and stuff like that. So that was working a lot more one-on-one with the nurse and sitting through the consultations, and also the doctor's consultations were really interesting. And then the third placement was medical surgical or acute care. That was in the hospital for me. So I was luckily placed in the stroke unit in Christchurch Public, which was amazing. They had a bit of general medical as well, and the teamwork in the hospital was just fascinating to see. I think each ward is totally different, and they have, you know, different dynamics going on and different team styles and things. But I was really happy with the ward I was on. I think they've since moved to the new hospital. So it's changed a little bit since when I was there, but that was fascinating, especially to work in such a specialized area such as stroke. I got to learn a lot about really specific, like what happens when someone comes in with a stroke. You know, they're brought in by an ambulance, and then they have to be mobilized really quickly to get the, you know, assessments that they need to find out what kind of stroke they've had, if they've had one or not. And then what happens after that, the sort of treatment, and it's very fast paced and very fascinating. And then into our, I believe it was in our beginning of second year or end of, I've lost track now. We did a mental health placement, which I also really loved. Lana and I were actually on the same mental health placement, and it was so interesting how, from our different backgrounds and our different experiences, how we had such a different experience on, you know, at the same place. And it just goes to show that, you know, different nurses are different, or to be nurses are different, and we all have our you know, different interests in what suits us and what doesn't. And that's why I really enjoyed this course for having such different experiences and being able to see. If it wasn't for all these different placements, I wouldn't have such a good idea about knowing what kind of areas I'd like to get into. So yeah, mental health was really fascinating. That was with working with people with sort of longer term, long-standing mental health issues who have come from a hospital setting, but they're not quite ready to go into the community, or maybe they've gone into the community, it hasn't worked out. So they need a sort of longer term supported residential style rehabilitation support. So, and some of them had moments of quite acute mental health issues. So that was really fascinating to be a part of. And I was like, all of these placements, I feel really honored that to be a part of these people's lives, you know, especially when they're in such a vulnerable scenario. And then the second to last one was complex care. So I was working in a like neuro facility. So with traumatic brain injuries, traumatic spinal injury patients, and also with patients who have had, or they were called residents really, because they were living there long term. They had neurodegenerative diseases like multiple sclerosis or motor neuron or Huntington's, and they were really, really interesting. All the different transfers involved and the hoists for, you know, people who were paraplegic or tetraplegic, and what that involved, and also different brain functions, and yeah, learned a lot there, a lot from like the support worker care people as well as the nurses. And then the final one is consolidation. So that's the 9-week placement, and yeah, there is a bit more choice around that. So that's something that's worth earlier on in the placement starting to think about what interests you the most in the placements and where you'd like to be in the future. But nursing is, you're never stuck in any particular area. There's always options to change. So I'm not too worried about wherever I go for my consolidation. I'm not worried that I'm going to be stuck there for the rest of my nursing career. I know that there's lots of options to change. So yeah, that's my clinical experiences.
Thanks so much, Laura. I'm just going to now share the screen and do a video for the Sun Centre. I think that's according to plan.
Hi, welcome to the University of Otago Christchurch Simulation Centre. My name's Darleen. I'm one of the lecturing staff here. I'm also
Jenny, I don't think that sound's working.
skills training, right the way through to complex immersive
Can you hear it
scenarios
now?
with full debriefing. We do very little didactic teaching here. Most of our stuff is hands-on, but we do use this room a little bit for short presentations, but also principally for debriefing students. So we live stream our scenarios from the areas where they take place through to these two screens here, where most of the students in the class will be watching from. So this room is set up really to look like a GP's room or an outpatient clinic room. We use this room for simulating difficult consultations, and we also do some intimate examinations in here as well, dealing with the important issues of communicating effectively with patients who are about to undergo sensitive examinations. This is our hospital ward. This is our patient who's in here at the moment, Charlie. Just catching up on a bit of sleep here. And we simulate ward patient scenarios in here. We would work with our colleagues in the paediatric department using Charlie, who's a fully computerized mannequin, simulates a 6-year-old boy. And yeah, so we use this room for a range of sessions, including serious illness conversations, working with dying patients, breaking bad news to people, as well as some work on sort of general ward situations that our students may come across. We use this room for mainly for procedural skills training. I've got the room set up for some teaching I'm doing tomorrow on how to give injections and how to collect arterial blood gas samples. As you can see, we have a full range of models, and we try to make sure that we adhere closely to good practice guidelines, so sharps containers and hand hygiene provision throughout the room. Typically, the students will be working to evidence-based checklists that we've developed over the last few years, and there'll be at least one, often two, faculty here working closely with students on helping them to improve their technique. So we're now in the control room. From here, you can see the simulation suite. We'll go through there very shortly. But to introduce this room, this is really where all our scenario directing is from, where all the technical activities that support our simulations are conducted from. We have technicians who actually help us to run all of the audio-visual equipment, and also our fully computerized simulator you can see behind me on the bed there, Alex. And this is the simulation suite. This is a room where we simulate a lot of high acuity situations. So we use this room sometimes as an emergency department room, as a recovery room. Sometimes we convert the whole room into an operating theatre. And we usually work on our patient here, Alex, who takes on a number of different guises and a number of different presentations. He's fully computerized. He's operated from the control room that we've just been in. And his vital signs, his clinical parameters will change depending on the program that we set and the interventions that the students carry out on him. So if the students make good clinical decisions and make the right interventions, then Alex's vital signs will change. He has the capacity for us to listen to his chest, hear a whole range of lung sounds, heart sounds. We can listen to his bowel sounds. He'll have seizures, he'll sweat, bleed, do a whole range of things. He'll talk to us, given the right prompts. And so we have the opportunity opportunity to both adjust his clinical parameters to replicate an illness or an acute presentation, and to respond to the interventions that the students carry out on him. So we're now back in the tutorial room for our structured debriefing following the scenario that we've just undertaken in the simulation suite. Our students are back here, and they're going to form a central part of an educational discussion, which looks at the actions they took, the way they organised themselves as a team, the decisions they made clinically, and the consequences of those decisions for our simulator, our patient Alex. Simulation as part of healthcare education is internationally recognised now as being an essential part of what we do. It's an aspect of the curriculum that is consistently well evaluated. In fact, we often have to run additional sessions for students who opt to come back and do some further practice with us. We look forward to seeing you back here at the Simulation Centre when you begin your programme, and look forward to helping you along your journey to your chosen profession.
Okay, so just like to open it up now for any questions. I think you just tap them in, and then Sandra will relay them to me if I can actually see some of these questions myself, so I wonder if I should just go through them. So one question is it possible to work whilst completing the course? Now, this is something that Chris Moyer and I often talk to, and I'm sure Chris might want to add something to this as well. So the clinical, we don't take a role for people being in class, but we definitely keep an eye on clinical hours. So it's the Nursing Council mandates that you do at least 1100 hours of clinical. So you have to be able to commit to completing the clinical hours, doing shift work as well as part of those clinical hours. So some students do choose to work while they're completing the course. As we have indicated before, it is a full-time intensive course. So some people are able to manage and juggle that, and some are able to alter their work hours to accommodate for the clinical. So that would be, at the end of the day, we can't say yes or no, it is up to the individual. I might hand over to Chris, because Chris has probably some insight in that as well from her perspective.
This is the work question, Jenny?
Yes, yeah.
Okay, and then I'll go on to the next one about placements outside of clinical. I think what we've found is that people can work a couple of days, and Lana and Laura might have more knowledge of this from their classmates and things. It's where people have a family and are also working and also doing the course. Somehow those three things can really push people over. So yeah, so you can usually do the course if that's all you're doing, and do a couple of days at least work. Yeah, but as Alana very clearly alluded to, it is quite a full-on course. What do you think, Alana, about working?
Personally, because I am only responsible for myself, in my first year I was able to regularly work around, I suppose, between 12 and 20 hours a week. It did definitely add stress, and I know a lot of classmates also probably worked part-time. I attempted to work a couple of weekends on clinical placement, and very quickly found that wasn't a good idea. So I think you definitely, if you are working, make sure that you're got either casual or have a boss that's quite willing to let you step out during clinical. I think that's probably my main advice because it was, yeah, I know those who had also worked during clinical, from what I heard, found that it was, you know, it was just a step too far. So yeah, be wise, but it is possible.
That's right, because if you're working, say, 5 weeks full time, and then you alter your work time to be working in the weekends as well, you might solidly be working for 5 weeks, which is pretty tough. So, and the question there about if there are clinical placements outside of term time, you probably need to get the timetable off Sandra for that, because we don't really work to the usual university terms. And for example, so the primary health placement in the first year and the complex care placement in the second year both go over that June, July time, which is usually the university holidays. The mental health placement is in very early in the second year, so it's sort of February, March. And just before that, the acute care placement is also late for any sort of tertiary institution. It starts in early November and finishes early December. So they are, I guess they are outside of normal term times, if that makes sense. Yeah.
I can answer the next one. How many students do you expect to enrol in February? At this stage, we're not sure. We don't have a cap on our numbers per se. Our cap is dictated by clinical placements and clinical access, so we don't have a magic number at this stage for capping the program. I can also, there's another question here looking at the minimum grade as a B, but usually what is the cutoff? So we talk about GPA being at 5. So that is a University of Otago a stipulation that if someone wants to do a master's, they have to have a B average in their last 2 years of an undergraduate degree. So we, or have to have a B average in their degree. So we usually say B. However, in some circumstances, we have looked at a person's transcript and their circumstances and what other potential work experience or attributes that they may have that may make us consider a slightly lower than B grade. But we do want to really reiterate that it is an intensive program and that it is a step up. The notion is that I try and tell people in orientation, it's a bit like when you go to high school and then you go to university, there's a step up, and it's exactly the same as when you come from an undergraduate degree to a postgraduate degree, there is a step up, and that's what it's supposed to be. So but we can often look at a case-by-case basis around the B average, but it wouldn't be a B minus, it would have to be closer to a B. I'm currently studying health science at Otago part-time. Will the fact that I'm studying part-time affect my eligibility to enroll in the Masters of Nursing program? Not at all. We'll still look at your transcript and calculate the full-time equivalent of your program over the 2 years, so we can make your B assess your grade on that criteria. So that should be fine. I think I've answered that about the course taken each year. We don't have a cap per se. We talked about students managing work or study. I think we've answered that one. Yeah, so there are 2 days on campus face-to-face teaching a week. And then, as I said, it is a full-time program. So each paper usually has about 32 face-to-face hours, and then each paper is made up, if it's a 15-point paper, it's 150 hours. Some of that's taken up with clinical. So as we keep saying, it is a full-time program. So the notion is you'd expect to be working on it so Monday to Friday in a full-time capacity. Sometimes some people find different papers, the concepts in them easier to grasp than others. So some papers may require a little bit more work than others. Like so Lana indicated, potentially some people from a non-science background may find some aspects of the science study requires a little bit more work, but then equally other papers they may find they don't have to work as hard to understand the concepts because of their previous undergraduate degree. So it is really on an individual student's basis, really. May I know the papers are assignments? I'm not quite sure what we mean by that question. There are assignments embedded in every paper. Most 15-point papers would have at least 2 or 3 assignments per paper. Within the clinically focused paper, some of the assessment is actually related to the clinical practice. So you'll have to show you're competent when you're out of clinical and you get signed off as part of as being competent, and that's part of an assessment. Other than that, we have mainly long assignments. The only tests or exams are in the science papers. How hard is the content for the student-led learning? So with the student-led learning, although it's self-directed, academics who are in charge of each of the papers do provide some online direction and resourcing. And as Lana indicated, it's important that if a student is having issues, that they get in touch with a convener of the paper to see what other resources are potentially available. But there is also the expectation that a student will read widely around concepts within papers themselves, the notion of being student-led. But there is direction. We use Moodle rather than Blackboard as our platform up here in Christchurch. So if you've come from health sciences, I think you're probably used to Moodle, but we use Moodle as our repository for resources that academics put up to sort of guide students' learning.
Jenny, just do you want to think, Hannah is asking, so there are 2 days on campus, is that correct? How many hours outside of this do you feel you put into studying? Do Hannah or Laura maybe want to respond to that? Because we can't tell them that.
So what was the question? Do you repeat, which question is that?
How many hours do you feel you put into studying each week other than the 2 days on campus?
I think it varies each week. And different people are different. I'm personally a procrastinator, so I save it to the last minute, but I don't advise that for this course. I advise, as Lana said, to chip away. Yeah, there's quite a lot of readings to do, like both sort of assigned or recommended readings, and then sort of like your own research and reading around a lot of the topics. I found initially there was kind of like a learning curve for me for the science, so I had to learn different textbooks that are recommended. Some of them were my Bible, like the science textbook was just, it was pathophysiology, and it was just, I read it like front to back throughout that paper, and referred to it constantly, just because a lot of the concepts were either like completely new to me or I'd studied them a long time ago in high school or something. So yeah, I think it depends on your previous knowledge around certain topic areas. Yeah, also it is definitely a step up from undergraduate university, so any papers, any assignments we were doing, like the sort of quality and number of references required for that essay are going to be a lot larger than what you would be doing right now in your undergraduate degree. So that meant just a lot more reading and research. Yeah. Alana, you have anything?
I think it's also a bit of like what you make out of it. I mean, you can, if you can put in a lot of time and not necessarily gain a lot from it, but equally if you sort of, or you can just like not put in the time and do it last minute. I think I would definitely recommend the textbooks. I never bought textbooks in my undergrad because I didn't think they were necessary, but I found them really useful in this course. I would say it's, if you don't get a concept, like even outside of the science papers, if you don't understand something, like come back to it when you're on clinical, because I find that often that makes a lot more sense. And then, like use a textbook or something to like, go back and then, apply it, or like understand the theory once you've seen the concept in clinical. I would say I put in a fair number of hours. The assignments, take time, especially if you're used to a test-based sort of undergraduate. It does take a bit to sort of adjust to getting a lot of assignments out, but you get into the swing of it, and you learn what's expected, and it become more efficient at learning, which is what you'd hope as you go through the program.
Yeah, I want to like reiterate, there are a lot of assignments and they're not necessarily like, sometimes they were on like, we'd have like a 2-week break and there happened to be an assignment due during our 2-week break, so it wasn't, we couldn't really treat it as a full break, or unless you're super organized and you did it beforehand. But you're not really doing things beforehand because you just handed in an assignment. So like, you know, you just hand in one and then you're getting ready for the next one, you hand that in and then you're getting ready for the next one. So it is quite like, you know, one after the other. And there are assignments due while we're on placement as well, because there are a lot of assignments that are based on that placement, so like case studies and stuff. So assignment heavy for sure.
Thanks, guys. We've got a question here. When do you find out if you've been accepted onto the course? So we do really like to try and be as timely as we can. So there's a number of university processes that students have to go through, and then there is an interview that I have to undertake around child to sort of sign people off as being safe to work with children. And then there's a police vetting process. So there's a number of processes that have to go through, that the students have to go through in order to be eligible and being signed off as being you know, able to be a part of the program. But we do like to let people know as soon as we can. So we try and turn around applications as quickly as we can. A lot of it depends on when students apply and then how quickly they upload their documentation and stuff like that. But we do we will let people know all the way through. Applications are open at the moment, so people can apply now, and we close up until we sort of have applications up until December. So students can be applying now, even if they haven't got their final results yet from their undergraduate degree. They can apply, and we can offer conditional offers depending on final results. So you can be given a place on the program, and it'll depend whether you meet the GPA. So that's something that you may choose to do now, is when you've got a bit of time. If you're interested, upload your documentation and make an application now. The course begins in February. And as I said, applications close around December, January. And what are applicants selected? We're looking at the academic aptitude for the program. Also, some other things that we're looking for around is your desire to be a nurse, really. Chris, have you got anything else you'd like to add to that?
No, I mean, there's the academic cutoff at a 5 or a B, but other than that, you know, our classes are great with the great mixture, I think, that people bring to nursing. And I think that, you know, Lana and Laura would attest to the fact that nursing is an art and a science. So those that come with the science learn the art, and those that come with the art learn the science. So it's, yeah, works out well.
What happens with classes and clinical placement during changes in COVID? So we've moved to an online format, and actually Lana and Laura can probably talk to that because they were in lockdown last year with their course. So what we did was we delivered as much as we could online, and then Chris Moyer is fantastic at organising clinical placements and working with the DHB, and she was one of the only ones actually that managed to get placement compared to other institutions, managed to get clinical placements for our students as soon as we sort of got out. So we ended up amalgamating our clinical placements together, and that was all up to Chris who did that. And some students who were in other programs didn't get that opportunity. So we're very lucky that she's got a very strong relationship with the clinical sector that allows us to do that.
I think we were lucky last year, the students only missed 1 week.
Yeah.
In the end, I think, but this year, that same group of students now, Lana and Laura, for example, their cohort is going in, you know, that we were just started their 9-week placement and we were pulled off at level 4, which was unfortunate. And last year at level 4, students weren't allowed in, but this year they really want this group of students to get through and get registered. So they've allowed them in our DHBs that we're dealing with, Southern and Canterbury, to go back in. So they've just gone back in this week. And so carrying on with their 9-week placement, which is great. Yeah, so, and hopefully their group that goes out in November, December will be fine.
The clinical placements run concurrently with the academic papers. So there are 3 in the first year, there are 3 full-time year papers that run throughout the whole year, and they're taught in study blocks. And then we have, and then in semester 1, there's 2 papers, a science paper and a clinical paper, and they sort of run concurrently. And the clinical hours are embedded in all the papers, but when you're out on clinical, it's often related more to whatever clinical paper you're doing. So they do run concurrently with the clinical paper, really.
Well, but they're not coming into class. No, they run separately on a timetable. Yeah. However, when you're out in 5-week block, you're out in 5-week clinical. So having said that, you'll be doing a case study and perhaps a reflective practice piece of work within that 5 weeks that are related to the paper that you're studying that will be marked as an assessment for, say, the acute care paper or something. Yeah.
The 2 days are taught in Christchurch at this stage. We haven't got any opportunity to be teaching in Dunedin at this stage, so that all the 2 days are up in Christchurch. So there's not a lot, as I said, with the exam component, there's only really science exams. The rest of there's science tests and science exams, but the rest of the papers are internal assessments like long essays or reflective pieces.
So yes, most of the assignments are essays, I would have said,
Yeah.
or case studies.
Case studies. Do you have exemptions or RPL for research projects from previous studies? No, we don't. You may get some RPL for a research paper, but the research projects really have to have a nursing focus. So unless you have done something with a nursing focus, then no, they have to be, they're a 30-point research project that shows your application of nursing to a primary piece of research. So RPL with a research project is not possible. No, you can apply for as soon as you've finished, or even as I said before, even if you're in your final year of your undergraduate degree, you can apply for this program. For example, could you apply to start a year after? So yes, and you can, and so sometimes people, yeah, so we have people who come from other jobs, so they're not all just coming from undergraduate degrees. So we have a number of students who have been out in the workforce, so they may have been away from their study for up to 10 years before they've come back and done some more study with us in this program. So there isn't definitely a time frame of when you have to apply after you've finished your undergraduate degree. That's up to when it works out for the student, really. So as I said about the part-time option, that's really a conversation with me, because I need to understand exactly what your other commitments are and what type of part-time option you're looking for. So that's probably better to have a one-on-one conversation with me. International students, we have a number of international students. And we've had, now we do have to let people know at this stage, the issue with being an international student is not so much being in the program. That's fine. The issue is when it comes to getting employment post the program. At this stage, most students who graduate from an undergraduate or pre-registration degree, I should say, go through this sort of national system to get a job called the ACE program. And in order to apply for the ACE program, which is the national repository of getting a job, basically, you have to be a New Zealand citizen or New Zealand resident. So that limits the job opportunities for international students is a bit more limited because of that. That's not to say that you can't still get a job post the program. It's just up to the individual student. Might have to do a little bit more canvassing themselves around different organisations to secure a job themselves.
I think in the current job situation, they won't be having any problems.
No, that's right. But we sort of just have to let them know that at this stage they can't through ACE. Yeah.
Mm.
And my paramedic bachelor's, we are attending school while on placements? No. So when you're on clinical, you're just in clinical for 5-week blocks or 2-week blocks or 9-week blocks. Yes, there is a possibility of being accepted before applications close. Yes, so as I said about the reason that we don't RPL a number of the papers in is because there is the notion of applying whatever you're learning in that paper to the nursing context. So when we talk about anatomy and physiology, that is a broad subject, but it also has clinical hours embedded in that paper, and you also have to, it's often applied to that nursing context. So that would be a conversation with me to have a look at the transcript, but generally speaking, we aren't RPLing any anatomy and physiology. And the other thing to remember, of course, unless you've done it at postgraduate level, and doing anatomy and physiology at an undergraduate level is at a bachelor's level, where you're doing the anatomy and physiology at a master's level. So they're two different levels. So it would only be if you'd studied the anatomy and physiology at a master's level. We can't RPL practical clinical skills in it all. The Nursing Council, as we talked about before, requires students to undertake the 1100 hours clinical skills themselves and clinical practice themselves. So we can't in the program.
Did you answer how many students were enrolled this year, Jenny? Sorry, did I miss that?
Oh, so no, I didn't. There's 33 this year.
In the first
in year one, sorry, yeah.
And 22 in the second year.
Does applying earlier than December give you a better chance of being accepted? No, there's no, it's really up to how you want to be planning for yourself. If you want to apply now, that's fine, but equally in December, if you want to wait for results, that's good as gold as well.
Did you answer the one really early on, Jenny? I just probably, sorry, I might not have heard. I'm currently studying house study in Otago part-time. Will the fact that I'm studying part-time affect my eligibility?
Yeah, I just said that we'd still be able to look at the transcript and look at the number of papers over to full-time equivalent.
Right. Okay, good.
Yeah.
Sorry.
Yeah, right. Is there any other questions? I think we've managed to answer most of them going through there.
How many people generally applied? Is that a question?
Oh no. Each year it's growing, we would have to say. So when we first started, there was about 8 or 9 applied, and only 4 ended up getting through really at the end, because we had a few people withdraw. So, and each year we've got more and more numbers. So I think last year we had quite a few that applied, more than 33 that actually came into the program. So it depends on the year. Okay, I think that's almost at the end of our there's one in the chat. Oh no, sorry, that's Billy telling. Okay, well, I'd like to thank everybody for coming along, and if people have any further questions, particularly around more details, say like they'd like to see a copy of the timetable, things like that, could you please, you can email nursing.science@otago.ac.nz. That's if you want really particular details around, or you want to make an appointment with me to talk to me about part-time options or things like that. I'd like to really thank Lana and Laura for coming along and talking for us today. It's been really good to have your perspective, and I'm sure those people out there would have really valued it, because it's so much easier. I mean, it's more meaningful coming from you guys than it is from us. And as always, thanks, Chris, for coming. Bye, everybody. Have a lovely evening.